You have to forgive me, but I'm at an age of senile dementia, so I have to write things I want to tell you. Many of the things I'm going to say, they're already discussed here, but okay, this is my own view of this. It's an exceptional pleasure to have the opportunity to see and speak with all of you tonight. Your presence here is so meaningful and rewarding to all of us who have spent our lives teaching, and we thank you for the opportunity. To begin, I would like to say a few words of tribute to the two very special teachers and mentors that have left us, Dr. Otto Garcia and Dr. Grace Wolf. I first met Otto in 1972, a couple of years after he was discovered, working as a neonatologist at Jackson. Previously, he had been an accomplished clinician and pathologist in charge of the cardiac catheterization at the Children's Hospital in Havana. In Miami in 1970, Otto was put in charge of the cath lab at Jackson by Mary Jane Jesse. His creativity in this lab is well known to all of you. One of his creations in the cath lab was Dr. Jay Shannon. Otto had superior knowledge in this field, with a passion for good clinical work, and he was a perfectionist in doing hemodynamics and angiography. Back in Havana, before immigrating to the United States, Dr. Garcia had assembled a unique collection of hearts with congenital heart disease, which he himself had dissected. Otto described the very first case of interruption of the aortic arch, confirmed by a post-mortem examination. Dr. Löw, Dr. Cazul, and later Dr. Tausig traveled to visit Otto's in Havana to see his collection. Nonetheless, Otto was humble, completely genuine, and he was gifted with a quick wit. So it was impossible not to love him and to be captivated by his radiant personality. Oye, chico, or bobo. Otto left us at 84 years of age, showing us his generosity and greatness of work until the very end. Dr. Eloína Garcia herself, an accomplished pediatrician, and the lab Otto's life has honored us with her presence in this reunion. Eloína. Now a few words regarding Dr. Grace Wolf. I met Grace in 1968 during our first year of fellowship at Boston Children's Hospital. Grace had moved from Marquette University to Columbia to do her pediatric training, and then moved to Harvard for her training in cardiology. In the very competitive atmosphere of Boston Children's Hospital, Grace was an oasis of kindness, graciousness, and peace. After her fellowship at Boston Children's, she practiced in Albany, New York. After that, it was our great good fortune that she was recruited by Mary Jane Jesse to a group in Miami in the late 1970s. In Miami, Grace met her future husband, Armando Perez, who has also honored us with his presence in this event. Grace became an accomplished electrophysiologist. She was one of the editors of the third book, Cardiac Concepts on Diagnosis and Management of Arrhythmias in Infants and Children. Grace also became the chairwoman of the board of Pediatric Cardiology. She published several seminal papers in the field. Some of you, including Ming Yang, were her students and contributed to these publications, and have continued the expansion of knowledge in arrhythmias and electrophysiology. Her premature death affected many of us very deeply. Perhaps one of the best sentiments about Grace was expressed by Judy Schachner, our chairwoman in pediatrics at this time. She was an outstanding doctor, teacher, mentor, friend, and above all, a radiant light, often full of laughter, goodness, and great positivity. Grace was well named. Finally, a few words for Dolores Tamer and Henry Gelban, which complete the old guard of our group. I have had the privilege of knowing Dolores for 44 years. Dee was trained in Buffalo at the Children's Hospital in Philadelphia. In 1967, she joined Francisco Hernandez, the preeminent pioneer in pediatric cardiology in the southeastern United States. In 1970, you already heard that, Dolores performed the first balloon atrial septostomy in a neonate with transposition of the great arteries in the state of Florida. Dolores was a superb clinician and was the director of the cardiac clinic for many years. On a personal level, Dee is not only an excellent friend, but she is a person of kindness and outstanding generosity. There are many examples of this, but I will mention just two. When I had just arrived to the University of Miami from Boston in 1972, Dolores and Akram let me use one of their cars. This was an extraordinary kind and generous gesture, considering they hardly knew me and didn't know how reckless I am to drive. Another example of Dolores' friendship and generosity is the fact that she spent the last days and nights of Grace's life by her side. Now to Henry Gelban. Heinz succeeded Mary Jane Jessie and Sidney Blumenthal as the leader of pediatric cardiology. I have also known Heinz for 44 years. During his long reign in pediatric cardiology, 1976 to 1995, he was always a benevolent boss, and when necessary, a benevolent dictator. He was consistently wise in his decision, and without fail, Heinz was a good and reliable friend, giving advice if needed, and sometimes when it was not needed, and always with a good sense of humor. You know that. Dr. Gelban worked and received a coveted grant from the American Heart Association to study pharmacology, arrhythmias, and electrophysiology. He also had the only NIH grant in electrophysiology for fellows. In 1977, he published a seminal book, Cardiac Arrhythmias in the Neonate Infant and Child, followed by a second edition a few years later. Within the specialty, these two books became obligatory reading. Under Heinz's leadership, the fellowship program, which was started in 1975, flourished. Dozens of papers were presented or published, many by you, the fellows of that time. Division morale was always high, and there was genuine fondness and friendship among the members of the old guard. And now El Gordo, a nickname affectionately given by Otto, which we all use, is a handsome and slim senior citizen. Long live the chief. In closing, I would like to thank the organizers, and everybody said that already, and collaborators of this reunion, particularly Ming and Jay. And I want to say a heartfelt thanks to all of you who have joined us tonight in this gathering. It is uplifting to learn what you have done, your lives, both professionally and personally. We see accomplished pediatric cardiologists, teachers, and leaders, many of you parents, perhaps bringing up the next generation of pediatricians and pediatric cardiologists. You have added yet another positive dimension to our lives of teaching. We feel tremendously honored in seeing not only that we have accomplished our mission of passing the torch, and knowing in turn that you too will pass that torch, but in seeing that you, our students, have gone on to become better than your teachers. Few things in life are more rewarding and more gratifying than watching the seeds we have planted become strong trees full of leaves and flowers of life. Thank you all.